Why we have convened this press conference is in respect of the state of affairs at Federal Neuropsychiatric Hospital. According to the World Health Organization, mental health in Nigeria has now deteriorated. In fact, it has increased beyond the average situation to around 20 to 25%. Despite these alarming statistics, the Federal Neuropsychiatric Hospital in Yaba, popularly known as Yaba Left, has become a completely broken down medical facilities. And we tie and put this entire crisis at the foot of Dr. Olugbenga Oweye, who for 4 years has been managing the affairs of that federal medical facility. Apart from widespread misappropriation of funds, including even what is called the drug revolving funds. Those are that specifically assigned finance for medical drugs, special medical drugs for psychiatric patients. They have been mismanaged. Now what is happening is that the drugs are not even available, and many of these patients, as you know, who are suffering from psychosis and neurosis, have run berserk in that hospital. In fact, many medical consultants and all that have been beaten. So what is the position now is this? The position now is that despite that very backward 4 years, his tenure has been legally extended by the Minister of State for Health and Social Welfare. Of course, backed up by the Coordinating Minister of Health and Social Welfare. Now we have very serious information to the fact that a purported recommendation has been made to the President of the Republic of Nigeria, that's President Tinubu, to ratify his appointment for second term, which is against circular number 1152 of the Federal Government of Nigeria, which prohibits that kind of recommendation. It says that once a medical director has finished his or her tenure, he will hand over to the next senior medical officer. But what we now have in Federal Neuropsychiatric Hospital is that you have someone who has finished his tenure, who has his tenure illegally extended, and now is being prepared to be for a second term, which is totally illegitimate. So what we are saying now is that second term is totally illegal, is ultra-vires, and should not be approved by President Bola Ahmed Tinubu. Well, I have filed a suit to that effect, in which I have joined issues with the President of the Republic of Nigeria, and I'm seeking another perpetual injunction, restraining the President from going ahead to approve that ratification. That suit is suit number FAC/L/CS 1252/2025. So we
have a situation where we have the Nigerian politicians, Nigerian ruling class, acting in a way that are not even normal, and we need a standard mental health care in Nigeria as it is today, because of the fact that the Nigerian political economy itself has standardized abnormality. And this is just a preamble to what is happening in Yaba, what people call Yaba Left generally today as an hospital that has been a standard hospital for resolving mental issues in Nigeria. But that hospital itself is in a gory stage. Its grave is being dug systematically, like the way the Nigerian healthcare generalist has been finished by the Nigerian ruling class. And how do they do this? What they do is to promote incapacity, to promote incapable people, to promote officials that are not for the workers, officials that are supposed to have left the ovation and left the scene. And as it is today, we refer to Dr. Benga Oweye, who currently is being that the federal government wants to recommend and get a second term, as if it's a political office, which is not supposed to be. We have a situation where he has outdated his years of being at the head of Yaba Left, and should leave with immediate effect, so that there can be an injection of a new standard leadership in that place. So we are calling on the federal government of Nigeria, especially the Ministry of Health and the Minister of Health, not to tamper with mental health care in Nigeria by politicizing it, one. Two, to also use this opportunity to increase the budgetary allocation to healthcare, such that there will not only just be one Yaba, mental hospital like Yaba left that is not being taken care of. There should be more for it, because it should be reserved for the situation, the current conditions that is in Nigeria today. And thirdly, we in the United Action for Democracy believes that the way and manner with which public facilities are being destroyed by the perpetuation of incapable hands should be stopped. So we are calling immediately on the Federal Ministry of Health to reverse the recommendation for the continuation of leadership and the second term, the purported second term of Dr. Gbenga Uweye, because for us, that hospital has gone so low in terms of standard under him, and somebody who has performed very badly should not repeat at that class as it is. It should move so that other people can take care of what's happening.